Blood clotting or coagulation is an important process that prevents excessive bleeding when a blood vessel is injured. Platelets and proteins in our plasma work together to stop the bleeding by forming a clot over the injury. Factors involved in blood clotting. Coagulation of blood occurs through a series of reactions due to the activation of a variety of substances. Those substances necessary for clotting are called clotting factors. The clotting factors are Factor 1, fibrinogen, Factor 2, prothrombin, Factor 3, tissue factor or tissue thromboplastin, Factor 4, calcium, Factor 5, proaccelerin, Factor 7, proconvertinin, Factor 8, antihemophilic factor A or antihemophilic globulin, Factor 9, antihemophilic factor B or Christmas factor or plasma thromboplastin component, Factor 10, Stewart factor, Factor 11, plasma thromboplastin antecedent, Factor 12, Hageman factor, Factor 13, fibrin stabilizing factor. Sequence of clotting mechanism. Normally during circulation, the blood does not clot because the enzymes involved in clotting are in inactive form. Slight initial activation causes clotting in which each enzyme activates another one in a sequential manner till the conversion of fibrinogen into fibrin. In general, clotting occurs in 3 stages, namely, formation of prothrombin activator, conversion of prothrombin into thrombin, and conversion of fibrinogen into fibrin. Stage 1. Formation of prothrombin activator. Prothrombin activator is formed in 2 ways. Extrinsic pathway. In this, the formation of prothrombin activator is initiated by the tissue thromboplastin. Intrinsic pathway. In this, the formation of prothrombin activator is initiated by platelets, which are within the blood itself. Stage 2. Conversion of prothrombin into thrombin. Prothrombin activator converts prothrombin into thrombin in the presence of calcium. Thrombin itself can accelerate this reaction by positive feedback mechanism. That is, the initial thrombin activates factor 5. This in turn accelerates the formation of both extrinsic and intrinsic prothrombin activator. Stage 3. Conversion of fibrinogen into fibrin. During this, the soluble fibrinogen is converted into insoluble fibrin by thrombin. Initially, the fibrinogen is converted into activated fibrinogen, which is called fibrin monomer. This polymerizes with other monomer molecules to form fibrin. The first formed fibrin contains loosely arranged strands. This is modified later into a dense tight aggregate by fibrin stabilizing factor, and this reaction requires the presence of calcium ions. Points to be noted. Blood clotting pathways, intrinsic pathway and extrinsic pathway. Extrinsic pathway or tissue factor pathway, initiated due to release of tissue factor at the site of injury. Extrinsic pathway is faster than intrinsic pathway. Both pathways are common after activation of factor X to factor XA. Enzyme responsible for clot lysis. Plasmin. Key enzyme in blood coagulation or hemostasis. Thrombin. Bleeding disorder is a condition characterized by prolonged bleeding or clotting time. Hemophilia, purpura, and von Willebrand disease are 3 types of bleeding disorders. The hemophilia is a group of sex-linked inherited disorder characterized by prolonged clotting time. However, the bleeding time is normal. It affects the males with carrier females. Because of prolonged clotting time, even a mild trauma causes excess bleeding, which can lead to death. Hemorrhage in muscles and joints are common. It occurs due to lack of formation of prothrombin activator, and hence the coagulation time is prolonged. Formation of prothrombin activator is affected due to the deficiency of factor 8, 9, or 11. There are 3 types of hemophilia. Hemophilia A, or classic hemophilia, due to the deficiency of factor 8. Hemophilia B, or Christmas disease, due to the deficiency of factor 9. Hemophilia C, due to the deficiency of factor 11. Purpura is a disorder characterized by prolonged bleeding time. However, the clotting time is normal. Characterized feature of this disease is spontaneous bleeding under the skin from ruptured capillaries. It causes small, tiny hemorrhagic spots in many areas of the body, purple-colored patch-like appearance. Thrombocytopenic purpura, due to deficiency of platelets, thrombocytopenia. In bone marrow disease, platelet production is affected leading to deficiency of platelets. Idiopathic thrombocytopenic purpura. It is believed that platelet count decreases due to development of antibodies against platelets, which occurs after blood transfusion. Thromboasthenic purpura, due to structural or functional abnormality of platelets. However, platelet count is normal. The substances which prevent coagulation of blood are called anticoagulants. Some substances are used to prevent clotting inside the body, that is in vivo, and some substances used to prevent clotting outside the body, that is in vitro. Heparin, natural or in vivo anticoagulant, produced by mast cells and basophils. Sodium citrate, used in blood transfusion in animals and for study of blood coagulation. EDTA, ethylene diamine tetraacetic acid, used in study of blood morphology, RBC index determination, and PCV determination. Sodium fluoride, used for glucose estimation.